And you're live, Mr. Reddy.
Hey guys, it's Dr. Emer. Now we are doing our energy treatment. We've already done our filler, we've done our TCA cross, we've done our subcision. Now we're doing our deep laser, which is called the Deepfx. This is doing very small laser beams into the skin to go deep, so that we get a lot of remodeling. It almost looks like nothing's happening, but it's much stronger than you guys would think. And he is doing phenomenal.
Is it painful?
Well, apparently not, because he's sleeping, basically. No, he's fine. He's on medication, topical creams, and nerve blocks, and he's doing great. It is painful. You guys have seen my videos before, I'm sure. But if you haven't, we do nerve blocks, we do pills.
Now what is happening? Where's all the action going?
The action is going deep down into the skin to help break apart scars and just resurface. What's going to happen is all these little spots are going to damage the skin, and then it's going to peel. And as it peels over the next few weeks, he's going to be red and irritated. And then over the next few months, collagen is going to form, and it's going to look smoother and better.
Gila says hello.
Ooh.
Gila.
Hi, Gila. I miss you. How are you? I hope you're safe on the East Coast. So now we're doing that on here to get rid of any of the textural irregularities and scarring. He's doing really, really good. With this laser, you don't really see a lot. There's not a ton of bleeding.
Tell us more about this laser.
So this laser is actually one of the most advanced CO2 lasers in the world. It's actually used by the government for burns and scars. And it goes really deep. The diameter of this is about 0.12 millimeter. And so it goes really deep, but very hot.
Now if you do CO2 over the filler, does it dissolve the filler because it attracts water?
Not at all. Studies have shown that the fillers are fine. Don't worry about the filler.
And it's 13 years you've been doing this.
Yep, 13 years. Board certified dermatologist. I've even done this on myself. And so you guys see we're going nice and slow, following a good pattern. And each of these little scans are going to cause little injuries. And it's going to smoothen out his texture and improve his tone. And because he's a lighter skin tone, he can get away with doing a stronger treatment, which is what we're doing for him.
Can this be used on darker pigmentation?
It cannot, unfortunately. This is ablative CO2 resurfacing. Perfect. And so this actually is too high of a risk for patients that are darker skin tone. So now we're going to let this sit a sec. I'm going to grab an ice pack. Hold with your right hand right here, okay? And with your right hand, hold right here. Turn all the way to the right now. Turn your head, turn. Perfect. So I already marked out the deep section. We're going to start on the left now. You guys can see, I mean, look how precise. It's almost like high-tech movie. You can see the laser just firing very precisely. It's very important to follow patterns because you don't want to get issues. You don't want to get hyper-pigmentation or any long-term issues.
Besides acne scarring, what else can this be used for?
Well, you guys, this is really good for wrinkles, pore reduction. This is something you should do for sun damage once every year or 18 months. You're doing good. So I'll fall asleep. Try to fall asleep, that's fine. You can fall asleep. We'll wake you up when we're done.
Alex Rojo says hola again. He's back.
Hola?
Hola.
He said hola?
Mm-hmm.
Oh, hola.
For those that just tuned in to Marcus, what is he doing to him?
Tell him.
He's doing CO2 laser.
What is it for?
It's for acne scarring that's going deep inside the skin. That's why you don't see anything happening. But
Yeah.
it's
We're going to work on the surface in a minute. Right now we're doing that fine tuning. Look at that laser, you guys. Look how amazing that device is. It's like a work of art. So beautiful. So he's doing really good. Alright, well I think that's it. We're going to keep going. It's going to take us a while. When we get to the active FX, which is the superficial part, we will call you back.
stay tuned.
Right, stay tuned. Bye guys. Great.